ahead.
Okay. Can you state your full name and spell it, please?
Catherine Kinsman, Katherine, Kinsman, Kinsman, but I go by Kitty.
Do I have permission to record this interview?
You do.
Where and when were you born?
Augusta, Georgia, May 10th, 1955.
So when did you come to Watertown?
Sometime when I was an infant.
I didn't know about the Georgia birth.
Fort Gordon, Georgia, actually.
Yeah.
Yeah.
Tell us about your growing up years and the journey that led you to this South Dakota State government.
Well, I grew up in Watertown, South Dakota. I was one of the oldest of 6 kids. So busy family, a lot of family events. Went to Catholic school for 8 years. Graduated from Watertown High School and went to college at Augustana and then graduated from the University of Colorado. Moved out to California after college, worked for probably a year and a half, and moved back to the state in 1979 and did some volunteer work for the Chamber of Commerce, which led to a job creating the South Dakota Glacial Lakes Association. And one of the people that helped launch that was a woman who happened to be the first CEO of the Chamber of Commerce in Watertown, Betty McNulty. And she helped me basically launch that organization. And one of the roles of that job, which I didn't really know at the time, was being an advocate for tourism in the policy environment. And so my first year and a half in office, I ended up being the first volunteer lobbyist on behalf of the tourism industry. South Dakota Tourism Caucus is what we called ourselves, to lobby for Monday Memorial Day holiday. And so that's what brought me to state government. But the policy work, I think I was thinking about this a lot in reflection. The policy environment and my interest in it really got started back in high school. I was a debater in high school, and Donis Roberts was my debate coach, and certainly there were others too. But I think that study and debate on policy issues ended up serving me well later on.
Mm-hmm. Yeah. The Glacial Lakes, I didn't realize that you were
the first executive director. We basically launched that organization. It was a group of about 10 counties in northeastern South Dakota, and it had kind of an informal relationship under the Watertown Chamber of Commerce just as an administrator. And as I said, Betty McNulty was the chamber director then, and I was kind of doing the administrative work on a project basis for the chamber, and we concocted the possibility that maybe this could be its own organization, similar to Black Hills Badlands and Lakes and the Great Lakes Association at the time. So we put together a proposal, and I became the first group, and now or first individual to start that and develop memberships and be an advocate, and that's ultimately what took me to Peer.
What was the atmosphere when you promoted the Memorial Day working holiday or non-working holiday?
In the political environment?
Yeah, the political environment.
So that was Walter Dale Miller was the majority leader at the time, and I can recall vividly there weren't very many women in Peer at the time. There were women in the legislature, but not very many women lobbyists, and so I had to take my cues from other fellow lobbyists at the time, and I remember distinctly the first hearing going in to pitch the idea. It was one of the small conference rooms up in the Capitol before they were all remodeled, but it was the biggest one. It was the State Affairs Committee, and I remember being in front of Walter Dale Miller and the State Affairs Committee, and behind me was a room full of veterans who were opposed to the idea of making Monday a Memorial Day holiday for their own reasons. And I was representing the tourism industry and wanting to make it a 3-day holiday, and that left an indelible impression on me on how you could organize people to show up and peer for an issue. We ultimately did win that issue, of course, but the political environment, I didn't really have an impression of partisanship then. I just knew that I had work to do, and I needed to find advocates within the legislative body, and we had enough of them, obviously, to be successful.
But a room full of veterans, that's kind of tough.
It was. It was kind of baptism by fire.
Yeah. So the question here is how and why did you become involved in state government? So talk a little bit more about that.
Well, serendipitous. I mean, I was in Watertown, running the Glacial Lakes Association. I was in, I think, my 3rd year. And in this Memorial Day policy debate, I came to Pierre, and at the time, Dave McNeil was the state chamber chairman, and he was helpful to me in terms of navigating Pierre, and actually, because I also worked kind of in economic development, had relationships with chambers and other groups around the state. Anyway, I got to Pierre for an orientation session on the legislative session, and got introduced to Steve Zelmer, who was the budget director, Governor Janklow's new budget director at the time. And we got to be friends later on in the session, and I have to say, I mean, that's what brought me to Pierre. 2 years later, we hit it off and got married, and I moved to Pierre, begrudgingly, actually. Wasn't my plan.
So when back in the Memorial Day movement, did you like that lobbying part of it? Were you initially taken with it, or was it not something you thought you wanted to do much?
I didn't think about it that way. It was just part of what I drew the short straw. We had like tourism groups around the state, and we all agreed none of us had money to hire somebody special. And so, I drew the short straw to be the first person to be there during a legislative session, and it happened to be that we were also going to do the Monday Memorial Day holiday. So I went there without, I guess, any preconceptions. I just knew what I needed to do, and I had some people there who showed me the ropes. And I had tourism people, of course, that were going to come to Pierre, and so it was truly a learning on the job. But I must say, I enjoyed meeting a lot of the people, lawmakers, lobbyists. I enjoyed that process, and it was pretty much unfamiliar to me, other than student congress back in high school. So. Yeah.
Did you go, when you went to state government, right into the health department?
I did. So I moved to Pierre after we got married, and was looking for work. And obviously in Pierre, most of the work is state government. I thought I would be doing an association job, similar to what I had been doing, but there weren't any opportunities in Pierre open at the time. So I began interviewing. I actually interviewed with DOT, with the Department of Labor, trying to think of anyone else, and then the health department. And it wasn't actually my first choice, but it ended up being the right choice. My background in college was in mental health, psychology, mental health, and business, and it ended up being the best fit, and I liked the environment. I liked who I was working for, and so it kind of just happened.
Who was the health secretary at that?
Lori Massa, who had come over to the department from the budget office. He'd been a budget analyst over that particular area, and when the prior secretary left, Governor Janklow appointed Lori. So he he was my boss for the time that I was there.
And then did you stay in the department and go on as secretary?
So I was assistant to the secretary, and basically he recruited me to do a lot of the legislative and policy work, because a lot of people in the department did not like to engage with the legislature. And I had that experience and was willing to do that, so I got recruited to do that and to do special projects. And then he left in 1985, to pursue an opportunity in the private sector, and I was probably for 2 or 3 months, not acting secretary, just I was a liaison between the governor's office and the department on a lot of policy issues, because I had interacted with the governor's office directly. So I think, Ed didn't know it at the time, but, it was an audition, an informal audition. So.
And that was 85?
That was 1985, yeah.
The experience of working as a cabinet member under Janklow versus Mickelson.
Well, obviously, I got my start under Governor Janklow, and Governor Janklow's style, and I came at the end of his second term as governor, so I worked with the administration for 3 years. And I would just say, Governor Janklow's style was a lot more engaged. He was a hands-off person most of the time, but when he wanted to be involved, he was involved. And health issues weren't his priority for the most part. So my feeling was, with the exception of our regulatory work over healthcare facilities, which he was engaged in, for the most part, it was hands off unless there was a problem, and then he wasn't hands off.
Then he would talk to you.
Pardon?
Then he would talk to you.
And then he would talk to you. And he had amazing, one of the things that I learned both personally, but also through other people, he had an amazing grasp of issues, and his memory capacity for things was unsurpassed in my life experience. And you would go into a meeting with him, bringing everything possible that you need to bring to advocate for your position and give him a briefing. And you could go in 2 months later, completely separate issue, kind of let the issues, let them be set aside. And he would bring it up. He would bring up the minutia of a conversation and an issue, and it astounded me, his capacity to remember things, and to dig into them, and to make you dig into them.
And Mickelson, what was that like?
Well, by the time I worked for, and I did not know Governor Mickelson. Many people had a relationship with him when he was in the legislature, and he wasn't in the legislature when I came to state government. So I didn't have a relationship with Governor Mickelson. When I interviewed with him, I had 3 years under my belt working in the department, so I felt a lot more comfortable with a prospective governor and kind of making the case. He was a much more hands-off policymaker from the standpoint of managing, and he was also open to pursuing issues. Again, I worked for him at the beginning of his time versus Governor Janklow at the end. Well, I thought it was the end of his time. But so I was different. But Governor Mickelson was a lot more hands-off. he also used his staff. He had kind of a kitchen cabinet model that was, some of us in the cabinet were not fans of, because it felt a little bit more insulated from the governor than Governor Janklow was. But I would say, in general, yeah, Governor Mickelson was probably a little bit more hands-off,
So
except
you got
on
to see a
some
lot of
majors.
Frank Frost is what.
Pardon, we got to see a lot of Frank Frost. Yeah, Frank and I, yeah, we used to go toe to toe when reports didn't show up on time. Yeah, Frank and Kelly Wheeler was
Yeah.
kind of the interface
Yeah.
at the time with she was the health and social services kind of policy, and we had a great working relationship, and the same with Frank Frost. But I think the transition from kind of having a direct relationship with the governor a lot of the time to having a little bit more hands off with Governor Mickelson was a difference.
Mm-hmm.
Yeah.
So they're asked how you gained traction as a woman in the largely male world of South Dakota politics. Was the door opened, or did you have to push it open?
It's probably a combination.
Yeah.
I think it would be a combination of both. I mean, I didn't really think about it like when I came to Pierre to lobby for that first time. It was really clear to me that it was largely a male environment. Both I didn't know many of the cabinet people, so I won't speak to that. But my folks I was taking cues from were largely men. There weren't very many women lobbyists at the time. I recall Diana Miller, I think, might have been one of the only ones in my memory. And so I think doors were open to me. As I said, I moved to Pierre, was married to the state budget director. So I think that exposure, at least I had some doors open to me. I knew the governor. When I came to Pierre, it wasn't somebody I didn't know. But then I think you got to ask for opportunities, and I certainly decided that I wanted to become active in some capacity at state government, since those were the opportunities. So I asked for the jobs.
They wonder too. Did you feel you had to work harder than everybody else in the room?
I don't know. I think the people that I largely worked around worked really hard. What I think I had to do is to prove that I wasn't a do-hire when I came to Pierre, that I could do the work, and I was unafraid to take direction and to do the work. So yeah.
Sure.
Yeah.
They wondered how your job and the goals in the way you got things done looked different under the two administrations. Can you kind of talk about that? Is there anything more to add to that?
Yeah, I mean, as I said, I came to work with Governor Janklow, at the end of his term, and he had some things he wanted to finish. One of the reflections I had, which actually led to some policy changes under Governor Mickelson. At the time, the department that I came in the department, we had a program called the Certificate of Need, which was a program that regulated the expenditure of major dollars on healthcare facilities, on major medical equipment. And so the department, approved major additions to healthcare facilities, purchase of equipment like CAT scanners and linear accelerators, anything that was a major expenditure. And the theory behind that program was that acquisition of that equipment would generate costs if there wasn't really a need. Mm-hmm. And so we had criteria to determine need. And these programs are all over the country at the time. Well, it was my experience coming into the department and watching my predecessor that a significant amount of time was expended in that program review and applications by healthcare facilities, hospitals, nursing homes to add beds, to buy equipment, to build new medical facilities. And there was increasing amount of political intervention by lawmakers and interest by the governor in our process and decision-making. And so when I became secretary and it became my signature on the dotted line for approving or not approving those applications, I was increasingly concerned that political interference was undermining our capacity to do what the program was supposed to do. And that was one of the recommendations when Governor Mickelson came to be governor. I recommended that we dissolve that program in favor of doing some other work, which we'll probably talk about.
So do I misunderstand?
Mm-hmm.
So if Regional wanted a new MRI machine, they had to get
Correct. If I recall, on major medical equipment, I think it was anything over $400,000. So that was back in 1985, and physician facilities, the same thing. If they wanted to acquire major medical equipment, nursing home beds were in high demand. And that was probably where we expended quite a bit of time, because the number of folks that would become Medicaid eligible in nursing homes because they had exhausted all of their resources, that was a huge impact on the state budget. And ultimately, when Governor Mickelson was interviewing me for the role of secretary, one of the things that Jim Ellenbecker, who was Social Services Secretary at the time, and I proposed to the governor was that we remove the Certificate of Need program, which the hospitals were in favor of, and the physician community. But in return, we implemented a nursing home moratorium to slow the growth of nursing home beds, which at the time were really the only long-term care alternative for people in need of care. And our rationale for doing that, one, was to eliminate kind of the political intervention in that Certificate of Need program, but the other was to slow the state's exposure on the Medicaid budget. And to do that, we put the nursing home bed moratorium in place. And what we were also motivated to do was to see less intensive resources, non-institutional resources, get investments that we didn't think otherwise would happen if we didn't clamp down on the number of nursing home beds. And that certainly, I think history's proven that we did the right thing there. Other than I'm still surprised that the nursing home bed moratorium is still in place.
Yeah, and I had forgotten it was that old. It had been that long.
Yeah, we passed it in 1987 or 1988, and so that was the deal. We packaged the removal of the Certificate of Need program with the nursing home bed moratorium, and then we implemented a pre-admission screening program to monitor who went into nursing homes, because candidly at the time, there were a lot of people in nursing homes that didn't need to be there and who were exhausting their resources. So it was, again, a way to control how institutional services were being used and hopefully push some of those resources out into the community.
They ask a little bit about who are the people you were involved with in daily activities of your position. Is there anybody that?
Well, obviously the department staff. All the especially in the beginning days, I spent a lot of time with folks in their Certificate of Need licensure and regulation of healthcare facilities, and increasingly my interest was in growing the department's capacity in preventive health and rural health issues, and so I spent quite a bit of time on those issues with the department staff. But cabinet people, governor staff, and then a lot of external work with different organizations: the Medical Society, the Medical School, Public Health Association, different constituency groups like the Cancer Society and the Lung Association. Yeah, there was a lot of external work.
Let's talk about a few of those preventative health measures and initiatives or activities.
Yeah.
That's kind of what you touched on.
Yeah, so the department, and you know, I'm not certain kind of where the department is today, but the department was largely the community health provider for a lot of the state. We had Community Health Nursing Network that was the public health interface, and through that program, we touched a lot of citizens in the state for vaccinations, for women, infant, and children program, maternal and child health initiatives, screening programs, and we had gubernatorial support and legislative support for a lot of those activities. During my time as secretary, I think we had one of the highest childhood immunization rates in the country. I'm not saying that because of me personally, but we were very proud of that, and that impacted our infant mortality numbers as well. So that was an area of focus. We created the first health education program, which was really to help mobilize education resources around healthcare issues, both for state employees as well as in communities. So my interest in the work of the health department, when it came down to it, I was much more interested in the preventive advocacy side of healthcare than the regulatory side. Obviously, you had to do both, but that was certainly where my interest was.
The infant mortality is still a fight.
It is.
Still a battle.
It is still a battle. You know, Governor Janklow, when I was assistant to the secretary, appointed me as chairman of the Fetal Alcohol Syndrome Task Force. I think it was back in '83 or '84. And that was when we were just becoming aware of the impact of alcohol use during pregnancy, and it brought infant mortality statistics, you know, to the forefront in terms of not just mortality, but the incidence of other conditions related to alcohol use during pregnancy. And we had, again, a lot of support within the administration for initiatives related to infant mortality and funding for programs. Although I will say, a majority of that funding was federal, and it probably is still today, in terms of what the state's commitment to those resources. But yeah, infant mortality remains sadly an issue, and the disparity between our native population and the white population is still really a challenge.
It was Linda Dugard's.
It was her focus when she was governor. Absolutely.
You touched on this, but so many people in the nursing home, maybe back then, and a number that didn't need to be there. Right. Long-term care alternatives, were they being explored at that time?
You know, not much. Yeah. So we also, through the community health nursing program, ran at the time the state's largest home health agency, and so we were aware of the absence of alternatives to keep people in their homes longer. I mean, we had a limited capacity to do that. I mean, you know, one nurse in all of the counties, maybe a couple. So, but we were in touch with where those gaps were, and the private sector ultimately, you know, grew to fill those needs. We had, you know, a couple of long-term care or home health agencies that came out of that are now statewide. The impetus to build congregate housing, assisted living facilities, I mean, those really came about after we clamped down on nursing home beds. The use of swing beds, which were, you know, in hospitals that can be used for long-term care beds theoretically on a short-term basis. We were a big user of that program in smaller communities that where the nursing home beds were clamped down. We could use hospital beds to do that. So It was the right thing to do, and I know it was painful at the beginning because people who were in small communities in particular, and it's still the case today, the staffing wasn't there to support nursing home care over the long run, but there also weren't people in the community to help people stay in their homes that didn't need to be there, and to make sure that they had 3 meals a day, things like that. So, yeah.
The nursing home bed moratorium had to be kind of a ignition point for some of that.
Oh, it was, and the nursing home industry was not happy about that. Thinking about how we got that done. When we put the policy package together, proposed it to Governor Mickelson. Our idea was, the Certificate of Need program, which we oversaw for both nursing homes and hospitals. We got a lot of support from the hospital organization, at the time was the South Dakota Hospital Association, and from the medical community to remove that program. And the nursing home folks would have been supportive of that as well, had we not had the nursing home bed moratorium as part of the package. And some communities were supportive. Even some nursing homes were supportive because it basically gave them a franchise for their existing nursing home beds. There weren't going to be any more. But the communities like Yankton, and Yankton was a pressure point, Rapid City was some of the last nursing home beds that were approved in the state at the time. There were communities that had nursing home beds on deck, ready to try and get more. We had quite a fight with those folks. Yeah.
So the AIDS epidemic, how did that affect you?
Well, that was, from my time as secretary and reflecting on, today and the pandemic that we've just completed. That was our public health emergency of my time as secretary, and similar to some of the COVID conversations of today, we knew some, but we didn't know enough. And so the science was trying to catch up with the policy. And there was a lot of fear, a lot of misinformation, but not the same vehicles to get misinformation out, a lot of bias regarding the disease and how it could be transmitted. So we were in a public education mode from the outset, and we really felt like we needed and were able to accomplish really positive legislative changes to update our public health standards and privacy standards related to public health, because we did it in partnership with the Medical Society. Dr. Bob Farrell, who was president of the Medical Association at the time, he and I led a task force, a joint task force, to put together the AIDS legislation that ultimately passed overwhelmingly in the legislature and set the stage for, I think, a civil conversation and good public information about people's risks, what transmission rates were, and what would happen if someone tested positive for AIDS. And thankfully, South Dakota was largely spared during that. But I think part of that had to do with the lack of misinformation and the vehicles to transmit misinformation at the time. Yeah, it would have been different. Yeah, it would have been different if it had been today.
Yeah, imagine.
Yeah.
And was it Bob Farrell, the ENT doc?
Correct. Yeah. Right. That I thought about that. One of the back to your conversation or question related to Governor Janklow and Governor Mickelson. Governor Janklow, he was kind of had a love-hate thing with docs in the state. I was never clear why. I mean, he had good friends that were physicians and whatever, but he just maybe just liked to go to war with people, and when Governor Mickelson was interviewing me for the Secretary of Health job, I had been doing Governor Janklow's bidding on some issues that weren't favorably viewed by the physician community, I will say. And I wasn't a physician either. When I interviewed with Governor Mickelson, I remember the pointed question. He said, do you have anything against physicians? And I said, well, no. I said, my grandfather, started Brown Clinic in Watertown, and my uncle's a physician. I've got cousins who are, no. He says, they're big supporters of mine during the election, and the whatever war you have going on with them as a result of Governor Janklow, I said, it's going to end. So I said, no, Governor. I said, I was doing Governor Janklow's bidding at the time on some of the issues that we were working on, and it didn't set well with some physicians, and that wasn't really material to Governor Janklow, but it was material to Governor Mickelson. Mm-hmm. So that was, and actually for me that was a positive move, because I was interested in working more collaboratively with the medical community and finding avenues to work together and to use their expertise, and that was certainly a vehicle to do it, and Governor Mickelson made that happen for me too.
So let's talk and hear about what were the big political issues of the day that mattered to you. That is banning smoking in enclosed public places. That's certainly a big political issue.
Well, we didn't pursue much of that during Governor Janklow's time. I remember going into his office, and kind of choking down the smoke. But when Governor Mickelson came on board, it was on my radar screen, and I had been kind of an instigator in our department building, which we shared with two other agencies, to get, like, the first stage was no smoking down in the little coffee room that was shared by all. So we got that, and then we implemented in the department a department-wide no smoking policy on the floors that we had, and so it was an incremental move. And when Governor Mickelson came on board, a couple of the things that I had proposed to him was to continue the progression towards a more smoke-free environment. And he wasn't even opposed to us dipping our foot in outside of state government, but he wasn't absolutely enamored with that idea. So I had to do a little bit of that undercover. But he was supportive. And again, our emphasis on preventive health and employee health costs and ways to move the needle on those. He obviously was supportive, because we couldn't get it passed in the legislature, advancing the public buildings legislation then. So by executive order, we implemented a smoke-free ban on all state buildings and state vehicles in 1988, and that was pretty big. Yeah. And then healthcare facilities. You probably remember the days. You could smoke in hospitals and nursing homes, and you could smoke anywhere.
Your doctor might be.
So it was that. That was kind of Governor Mickelson's leadership to kind of set the stage for what would come later, and certainly would come later for me in my private work. Yeah.
Before we move on to that, what was the reaction at first when you started within the health department? coffee room and then the floors.
Well, depended on whether you were a smoker.
Yeah.
You know, that was when people then, you know, had to go outside. So those things became notable. My colleague, Bob Neufeld, who was the secretary for the Department of Water and Natural Resources, he would come and whine to me about, you know, the fact that we were trying to do this and it was impacting his staff and productivity because people were going outside instead of like going down to the coffee shop, or they couldn't smoke at their desk or whatever. Yeah, I probably didn't win any like support from some of my colleagues. But then others were like, how, you know, I can't believe we haven't done this. Because the ventilation system, you know, we were in the Foss building at the time. It was horrible.
Oh, yeah.
So even if you weren't around somebody that smoked in your office, you were.
Yeah.
Yeah.
Absolutely.
Yeah. So, we had our champions, and yeah, it set the stage for later conversations. And really, for me, that was how we got the hospitals to move, the major hospitals, and that became kind of the next big chunk, you know, of healthcare facilities in general being smoke-free.
Do you remember the old press rooms up on the fourth floor of the
Sure
Capitol?
do.
The narrow, about like this, and then one little window there.
Yeah.
We had about 6 smokers in there. I could have been. I might as well have been smoking.
Absolutely. Well, I remember when I came my first year lobbying when I was Glacial Lakes secretary. I remember you know, all the smoke-filled rooms. I remember I was talking about the state affairs hearing on the Memorial Day with the vet. I mean, everybody was smoking. It was it was a different time.
Yeah, I don't know how we're all still alive.
Some of it, yeah, some, yeah.
Yeah, some, unfortunately. I can list a number, but they were actual smokers.
Those were actually smokers, yeah.
On that, as it moved on, maybe we'll skip forward a little bit, but taking smoking outside of state government in your work.
Right.
Talk about that.
Well, and who would have known? I mean, I left the state, you know, in '89 and didn't come back until '96. And
that was you're in California.
That was when I was in California doing my fellowship and other work. So when I came back to the state, I actually didn't know, you know, I didn't have a plan when I came back to the state. I got a call out of the blue from a local physician here in town, Dr. Nord, who I did not know, but who was active in the smoke-free efforts. And he called me out of the blue and asked me if I would help them get things organized in the state to kind of advance tobacco-free initiatives. And I said no. Because I had been doing software, I had a software company in between, and you know, I just saw myself in a different place when I came back to the state, and so I said no, and then he called about a month later, and we kind of had a re-conversation, and I was like, how did you even find me? Well, he'd found me through folks that I'd worked with and worked for me in the health department who'd gone off to do other things and knew I was back in the state. So I said, well, okay, I'll look at it, and I can probably connect you with some people, and that began like a 10-year effort that, you know, again, serendipitous happening, but we built a coalition and with organizations like the Cancer Society, the Heart Association, the Medical Society, grew that to like 50 different groups around the state, and together we made it happen. I mean, Dr. Nord, Dr. Weiland, Jennifer Stalley, people that were instrumental in kind of moving the needle, and you know, I got to lead a lot of it, which I'm pretty proud of. In terms of public health initiatives that have long-term implications. I mean, it changed the culture in the state.
How did it change the culture in your mind? What were the most important things that came out of all that work, or have come out so far?
Well, I think you could just talk to anybody now. You just don't smoke inside.
Yeah.
I mean, and that's a huge cultural change.
Mm-hmm.
And in South Dakota, when we finally passed, even at the ballot box, the final initiative, South Dakota is actually one of the strongest smoke-free laws in the country. We actually had gaming facilities included, which was unheard of in other areas. And it I think what we learned in that process, through the ballot, was that the public support, because it was over 60%, was there. The barrier had always been the legislative body. And so the culture changed now. I mean, I've talked to young people, and they have they can't believe there was ever smoking in facilities, and think about when you see someone. I feel a little badly about this, but it's almost like if you're smoking, you're a pariah.
Well, really, you're smoking?
Pardon? Yeah.
I see the same thing. I see somebody say, seriously, you're smoking?
Yeah, and there are more young people smoking today or vaping, than I think there were. I shouldn't say, I don't know the statistics today. I think tobacco use is down. I don't know what the comparative numbers are on vaping use, but with everything we know, it saddens me that that we got into that initiative largely as a preventive measure for young people, children and young people, to not take up the habit. And the tobacco companies are slick. They find their ways through advertising, and as they always have. But there's a culture change, and it's all for the good.
Oh yeah. You mentioned Nord. He was my GP till
Okay.
he retired. And at the end of every annual physical thing, he'd say, "Well, is there anything new in your health that I should be aware of?" I'd say, "Well, I started smoking." And he went, "What?" I did it to him every year, and he forgot every year. And he would just come unglued.
He would. I'll tell you what. When you think about people that inspire you, he was one of those compassionate, passionate people whose willingness to engage always inspired me. I mean, he just gave it his all, as many did. But I mean, at a volunteer level, he was one of those people that I always felt I could call on, and he got me into. I mean, I blame him and give him credit for getting me involved in this. So.
Yeah, Evan Nord's son,
Yes,
Yeah.
I know.
So he
I
had
know.
that real connection. Talk a little bit about they want you to describe the political environment in the state at the time you were going through this active public, work.
I guess. I think.
Wait a minute. Let me reframe that.
Okay.
Because there's another question here that I missed, which what did you think of the national leaders, presidents, senators, representatives, at the time and the issues of the day? What did you think about the South Dakota political delegation?
Well, so my memory serves me. We had Senator Daschle, Senator Pressler, and I think Congressman Abner.
And then Johnson.
Right, and then Johnson after.
Yeah.
But during my time as
During
secretary.
Because Abner beat McGovern in '80, so he was in the Senate from '80 to '86.
Okay.
And then
Daschle beat, right. So I didn't have a lot of interaction with our federal delegation.
Mm-hmm.
Senator Pressler was a big advocate for long-term care, nursing home,
Oh,
that
that's right, yeah.
population. And, but we didn't have a lot of interaction. I mean, my role in that arena was largely a regulatory one. And so we didn't have a lot of interaction. My work with Senator Daschle came when we were organizing our efforts to create the Office of Rural Health. Senator Daschle was very active in the rural health. I mean, he may have chaired one of the committees, and we were able, as a department, to testify on behalf of the need for more resources in rural health, and we actually, during my tenure, established, in conjunction with the School of Medicine, a joint Office of Rural Health to help both recruit and retain health professionals in the state, and think about the policy issues that would positively impact rural health. So that was probably my interaction. Not, I wouldn't say significant, neither positive or negative. I think they were helpful when we needed help.
How would you describe the political environment then versus, say, now?
Well, way less partisan.
Mm-hmm.
When I came into state government, if it wasn't that year, it was during my tenure. I mean, the Senate was a majority Democrats, and the House was Republican. So there was a lot. You had to work with both parties. I think when you had policy discussions, a lot more of them were out in the open, because you had both parties that you had to make the case for. So I would say it was way less partisan than it is today. Not that we didn't have partisan debates, but I feel like you really had to make your case to both constituencies, and the decisions that came out of that time, I think, were more consensus decisions than I think they are today.
Mm-hmm. I want to wonder about your thoughts on the economy and what was going on. Were there anything that stands out?
Not for me personally.
Yeah.
Again, in my policy environment, I don't recall.
Among your many achievements, honors, and accolades, I wanted to read that because I don't usually use accolades myself, but are there some that you are most proud of, or you consider some of the things that you did that you feel really good about?
Well, certainly, we just talked about it.
Yeah.
I think the smoke-free, state smoke-free initiatives are a crowning achievement, not just for me, but for all of the people that we work together to make that happen. I think again, childhood immunization during the time I was secretary, pretty proud of that. When I left the department, we had just secured funding to build a new state health laboratory, which, the state health laboratory is the reference laboratory for a lot of what happens in the state, and the facility that we had when I was secretary was severely outdated and lacked capacity, and so the funding for that was secured while I was secretary, and that certainly came in handy during the COVID pandemic, and probably today lacks capacity to handle future pandemic initiatives. So,
was there any? Can you think of anyone that were your mentors, a big influence on you, somebody that helped you shape your life or move forward in your life?
Well, I've already talked about her. I think Betty McNulty, who happened to be probably the first woman CEO that I was familiar with, as the chamber director in Watertown when I came back after college. She imprinted me with her leadership skills, her capacity to collaborate and to bring people together. I was very attentive to the way in which she did her work and the way in which she engaged people, cross-section of the community. When I got to peer, I paid a lot of attention to lawmakers and their style of doing work, obviously to the governors and to my fellow peers in state government and how they did their work. And I don't know that there was one person. I paid a lot of attention to my husband, who was budget director, who I had a great deal of respect for the same reasons I talked about with others. His way of working with people and way of handling tough issues in a civil and non-personal way. And I think when you're in the policy environment, which I've now spent most of my career in, finding ways to talk about issues and identifying interests, common interests, is a skill set that I've paid attention to the way people have done that. And in the public health arena, people like Dr. Nord and even my colleague Jen Stalley, folks that I worked around that if you pay attention, you learn different things from a lot of different people. So it's hard to single people out. I obviously did.
And I think this maybe comes from Pat Miller, because I think she always asks this question. Thoughts on the first woman governor?
History's going to be her judge in terms of her policy decisions. So I think I'll leave that for folks who are going to follow. I think my observation, based upon how she ran for office, she probably has the least transparent administration in my experience, both having worked for 2 governors and having worked around 3 others. And that's, I think that's just an observation. And as an example, in my time in state government, nobody really wanted to talk to the press. We weren't all looking for the press, unless we had something, of course, that we wanted to get out. But we weren't discouraged from talking with the media, and you would learn about it, later if you screwed up. But we weren't discouraged from talking to the media. And we didn't use public information officers to avoid talking to the press. And I that's certainly something that's quite different. And I don't know if that's a function of just there's so much information overload and so many ways to get at people these days that the choice has been made to shut down. But that's certainly that's a difference. And I don't think it served the public well, but it seems to be a feature of the day.
And they wonder what advice you'd give to aspiring activists or politicians today dealing with all of that.
It's probably the good advice for anybody, I think, to listen to people, to be an active learner on issues. One of the things I really liked about my work, over the years in policy is it was always an opportunity to learn new issues, and figure out kind of where people were coming from and figure out how to align what you wanted to accomplish with someone's interests. And I think in order to do that, you've got to want to learn about issues, and then learn about what people are interested in, what makes them tick, and how to align. So I think that makes a good policymaker. I think it makes a good activist or advocate. I always, activist is kind of always been an interesting term for me. I prefer to see myself as an advocate, and but probably qualify in both. And then facts are good. I think, and being credible with facts when you're in a policy environment, so that you can gain trust with people, even if they don't agree with you. I think that's important for long-term success in that environment.
Maybe that's a good transition to this question. Where do you see the political climate in South Dakota going in the future?
It feels like it's going to be more partisan for a while. I don't have a crystal ball. Until we figure out as a citizenry how to hold people accountable in this new information environment, I think the partisanship is going to continue. In South Dakota, it seems to me that we're moving towards a policy strategy of using the ballot as a way to move issues forward that apparently don't get a voice during the legislative process or in the governor's office. And I see that probably continuing as a strategy at least certainly in the near term, maybe for the long term.
And this is a question that maybe is a little more fun. What do you think of South Dakota as a place to live in your younger years and now? You're still here.
I'm still here. So, certainly now in reflection, I moved back to the state twice. I really, in both periods of time, didn't plan to stay for a long time. And what I've learned that I appreciate most, it's a small enough place that when you want to get something done, the number of people that you need to move an issue forward or to accomplish something is a lot smaller. Your distance between an action and decision makers who can impact an outcome is much smaller. And so I feel like it's a place where you can really make things happen, and regardless of your circumstances in life, that they're just the layers of bureaucracy, whether it's state government, city government, or just organizations, is much smaller, and I think it enables people to kind of move forward. And that, for me, that's probably been the most exciting part of all of the work I've been able to do, and when I've watched other people in policy, whether it's governors or lawmakers or my colleagues in the lobbying environment, I think we would all say that it's good to be small sometimes.
Is there anything else that you want to talk about that we didn't talk about?
I just have an appreciation, regardless, think we've talked about, my time in government. I have an appreciation of pretty much all the people I've had an opportunity to work with, regardless of their political stances, oftentimes regardless of whether or not they supported me in policy work or supported the governor. It has been a rewarding adventure for me, and it's put me in contact with people all over the state and all over the country that I probably otherwise wouldn't have had the opportunity to have. So I'm a pretty lucky person.
Okay,